What's up, guys? We're back. Don't submit yourselves, part 2,
right.
leg lock edition.
Yeah. At Mobility Doc, we've been talking about feet and how to restore arches, how to rehab your foot and your ankle. I thought it'd be really interesting to bring that foot and ankle work to the perspective of a jiu-jitsu athlete and really any barefoot athlete. But in jiu-jitsu, these exercises that we're sharing with you are going to be great for rehabbing. But as you're starting to strengthen your foot and your ankle so that way you can do different foot sweeps, it'll be important to strengthen this part of your foot.
So guys, we're just going to talk about some different aspects of recovery and strengthening today. One thing that happens in jiu-jitsu sometimes is people grab your foot, right? They grab your foot and they just try to twist it. One way that people can grab your foot that can cause some harm to your foot is called a toe hold. So from here, I'm grabbing my partner's toes. My other arm goes around my partner's heels. And from here, I don't just push on my partner's toes and pull it to my partner's butt. I push on my partner's toes, I pull my elbow to my chest, and then I rotate, and my partner's gonna tap. I push, pull, and then I rotate their knee right here. It puts a lot of pressure, not only on the top of your foot, but the ankle as well, okay? A different one that we can also talk about is a straight ankle lock or an Aoki lock, some different variations. When I get my partner's foot like this, I'm leaning back on the top of my partner's foot right here, so I'm squeezing my partner's ankle right here, and I'm also leaning back. When I add the pressure of my hips or different leg configurations, I can really hurt my partner's foot. The last way that we can look at healing our partner or hurting our partner's foot is an inside heel hook or an outside heel hook. And from here, all we're gonna do is we keep a tight bite on the top of our partner's toes right here. We lock our hands, and from here, a lot of times people rotate right here. But all we're gonna do is we're gonna stay heavy on our partner's toes, and it's just a slight bridge through our partner's knee. So in this one, this is a lot more severe for your knee, but everything kind of starts at the foot. I catch at my partner's foot right here, and as I go to bridge right here, I can rotate, and that can hurt your partner's foot. So those are some different ways that in jiu-jitsu, you can hurt your foot along with your knee, but we're gonna look at some ways of strengthening and healing the foot today.
Let's get it.
Dr. John.
Yeah.
I hurt my foot.
Oh no,
Yeah.
Let's fix it. All right, so you got caught in any of the leg locks that Renee was just talking about, and now you're trying to rehab back. So one of the best strengthening exercises that you can do for yourself is actually the strength exercise for the tibialis posterior muscle. That tibialis posterior muscle runs along the inside of the shin and under the foot, and it is responsible for the shape of your arch itself. Without the tibialis posterior, there's no arch. And a lot of people, I was saying to Renee, do tib raises where they're pulling up against weight, but the actual tibialis posterior is responsible for going down and in this way. So what we're gonna do is you're gonna strap this up on your big toe. You can play around with the amount of tension that you're putting through here, but you're gonna point the whole foot down, and then you're gonna turn in towards me, just from there.
Yep. That?
Exactly. And then
a little bit better. Down and then in.
Yep, and then back. And
back.
And the whole way that you're doing it, you're focusing on also the way back. So exactly, it's like a smooth movement as your foot starts working back towards you. That eccentric contraction is a good opportunity to continue to strengthen.
I feel it in my calf and my hamstring too.
Yeah, exactly. You'll and you had pointed out, maybe you can detail this a little bit more for me, but say you were trying to even guard yourself from some of those positions. Yeah. It sounded like you one of your movements would be to plantar flex.
Yeah. Yeah, so in any kind of, maybe a toe hold would be a little bit different, but in any kind of heel hook situation, straight ankle lock situation, this is actually very new phenomenon in jiu-jitsu. People always used to dorsiflex like this, right? Yep. And it's just not the best way to defend. The best way to defend is with this plantar flexion and really extending your leg in a lot of different situations. So it's really effective, but at the same time, you can be going against somebody who's really good at leg locks or really strong. So definitely being strong and mobile here is really important.
Yeah, and clearly tibialis posterior as well as your gastroc muscles your calf muscles are responsible for like getting you that point, that plantar flexion. So like not only is this good for like if your ankle popped, but if you're trying to like really strengthen that position of plantar flexion and also work on the stability in your ankle to better like defend yourself in certain positions, this is just like a solid exercise for it. Normally you're going to do like 10 reps to 15 reps. You're kind of just developing your tolerance. Yeah, exactly. Yeah, and you might find like you might want this tension out like this way a little bit more. Exactly. Is it harder on this side for you?
A little bit.
Yeah, you can see it looks like a little clumsier on the side.
Yeah.
Which is like something that you might find when you're doing this is, you know, it's like not just right foot, left foot, it's like what's the right foot like compared to your left foot. And depending on a history of rolling your ankles or being caught in different like holds, in your case, maybe it's something to do with the way this left ankle has been used or abused compared to the right side.
Yeah.
And also there's dominance, and sometimes it's just a matter of...
I think I'm a righty, yeah.
Yeah. But sometimes you're going to have to skate with the left.
Yeah, for sure.
Yeah. And you don't need to have like a fraction of a second slower on this side.
Right, yeah. I'm excited to do it a little bit more, but I guess, yeah, I have to do it on both sides.
All right, let's ready for the next 2 exercises?
Yep, let's go.
All right, awesome. Next thing we're going to do is we're going to roll the bottom of the foot, because now that you got caught in a lock and your ankle popped, the next thing you need to do is like get blood flow and circulation going, help healing start, using the Hyperice mini sphere, because I actually like that it vibrates, because that vibration also helps to create relaxation in the muscles of the bottom of your foot and increase blood flow and circulation.
So we have 3 different vibration settings. The more the vibration, the more the blood flow, the more the oxygen.
Yeah.
So I'm just gonna put it down like this.
Yep.
And like just roll from top to bottom.
Exactly, and when you want to also find some spots that hurt, you know, like, and then just hold.
So a spot that kind of feels not tender, but just like a little bit, it's like right there.
Yeah, and you'd spend like, you know, 30 seconds or so on the foot, maybe repeating it a few times. You could spend up to 1 minute to 2 minutes, really.
So I want to kind of relax my foot, or do I kind of want to like step on it?
Well, you want to let your weight get there, but you want your foot to relax over top of it.
Okay.
So it's not like as much of like, you don't want to like get tense and squeeze, but you want to like let that foot like, and also get like kind of the inside here. Because it's somewhat the pressure, but it's a lot of the vibration too that's helping. Like this is a big one for especially the toe hold, right? Like if someone's popping more towards like your midfoot or forefoot, like this will help to reshape that. But even if it's more coming from the ankle, you're going to want to relax the structures under the foot, and this will increase blood flow and circulation higher up.
Yeah, feels great.
Yeah, and if you have only like a lacrosse ball or something like that,
works too, right?
That's fine. I mean, if you wanted to, you could always use like a hypervolt gun.
Yeah, I don't have one of these, but I have the gun, and the gun is definitely super effective.
Yeah.
Where can people buy these?
So if you're local to Mobility Doc in Bethlehem or Stroudsburg, you can definitely stop on in. We get it here.
Promo code Renee10.
Yeah. But no matter where you are, if you get one of these, they truly are a great device.
Hyperice.com.
Hyperice is like, they work with us in our PT clinic to help outfit everything we need for our patients. So this would be like, this is the same tool we would use if you were injured and you came to us.
And this is obviously not just for your foot. You can use it on your back. You can use it on your hip, TFL,
calf. Yeah, exactly. If someone has attacked your legs, attacked your ankle, and you had anything pop, one of the things you're going to need to do is you need to try to work to restore the arch itself, no matter what you were starting with. The muscles that are like deep to the foot itself, the extrinsic and intrinsic muscles, which Renee thinks that I've made up, they're difficult to rehab because you can't just go through big, large movements and get to them. It's really subtle exercises that stimulate those muscles, so that way your foot can be strong. Because one of the things is you obviously don't want a weak foot, right? Like, and speaking to just resisting people putting you in positions, if you have weakness anywhere in your foot after a submission, then that's going to be your next problem. So think of this like you have this dome here, this talar dome forms, your arch dome. And what we need to do is we need to reshape it. Renee has what we'd call flexible flat foot, in that like you have the ability to have a higher arch, but like right now as you're standing, the arch has dropped a little bit, which is not like a terribly big deal. But it's what that means is we'll be able to see like a pretty good increase in your arch while you're doing the movement. So if someone has a more rigid foot, you might not see as big of an increase, but that's okay. So what I want you to think about, Renee, is let this foot step back a tiny bit for me. Perfect. But keep weight on this. There you go. And now what I want you to do is you're not going to get the movement from your hip or from the knee. You're going to try to lift this arch up for me. So yeah, exactly. So and you want to keep your heel down and relax your toes. Yeah, you want to keep this like the inside of your foot, outside of your foot, and your heel down. And you want to try to lift this arch up this way. Yeah, there you go. And what you do is you'd own that for a couple seconds when you're there, and go ahead and hold it up for a moment. Let that heel back down. Good. Now relax your toes, wiggle them a little bit, but keep the foot up. Yeah. So that's the position that you're trying to find in it. Let me have you rotate a little bit so your foot. Yeah. There we go. Exactly. So here, and then you're gonna lift this up.
Toes relax.
Yep.
Heel down. Kind of like that.
Yep, that's getting better. And you don't have to worry about bringing the knee forward so much. You keep this here. Exactly. It's a really subtle movement. It takes like a little bit to get used to, but like as you get more comfortable with it, what we're kind of looking for is like this to kind of come like, this is me flat, right? This is me raising it. I'm wiggling my toes a little, trying to bring that inside of my foot up. So I'm bringing this up, but I'm not just like twisting my knee. I'm actually pulling up from the inside of my foot, trying to keep my arches relaxed. You do like 10 of these, 3 sets of 10, and work on them, especially after you've rolled through the bottom of your foot, used maybe the gun through the bottom of your foot, or used the massage ball that vibrates on the bottom. This plus that posterior tibialis exercise that we went over will kind of be the complete picture of rehabbing the foot, because what we need to do is need to break up all the scar tissue using like the ball in the case of what we did, increase blood flow circulation. This is how you regain the stability in your ankle and your foot after it's went through some kind of trauma. And then the strengthening exercise, or the posterior tibialis exercise that we went over, that's how you develop then the strength. So we've got something for breaking up scar tissue, something for regaining stability, and something for re-strengthening. So you want to make sure you hit all 3 and you don't miss one of them. And if all you do is strengthening, you're missing out on stability, you're missing out on breaking up scar tissue and helping with healing.
Does that look okay?
Yeah, it's good.
It's kind of hard.
Yeah.
It's not easy.
No, yeah, exactly. There you go.
That's it.
Yep. Yeah, it's a little harder, and the uniqueness with BJJ athletes, kind of like gymnasts too, you're like you're barefoot all the time. So chances are you're probably going to have like feet that are strong, but like your arches are going to be a little lower than most, because you haven't had any support that's going to be helping to keep it up.
Should my knees be over my toes or behind my toes?
Yeah, the more comfortable you get with it, you would actually have weight on it. So like most of the weight on the foot itself, but you don't have to have like your knee forward. You could just have like just more like center of mass.
Definitely like a really good thing that you could do like before any training session or after or something like that, just to like kind of warm up. Maybe these would be kind of more like rehab, but like
it's a good activation exercise to like kind of like get some mindfulness, and something I want to explore more but haven't yet is like the connection of like the foot and the arch for a barefoot athlete, because if someone has like a really flat foot that's like weak and lazy, and then you're trying to like shoot in, like you're
that's
gonna,
what we do,
so you're gonna be losing.
And you know what's so interesting too, like when we train, right, most of the time, not to get gross, but like the mats are super sweaty. Like it's really important to like have this like good grip on the like, because we're not wearing wrestling shoes, right? So it's like that's something like I'm very cognizant of, just because like as soon as we start to like train and it's just really slippery, like you just really easily slip your foot out. Actually one thing I haven't told you that I've been working on is like judo. So we've been working on like a lot of like foot sweeps, and my foot's been like pretty sore right here, just because like the 2 motions, like if you step your right leg forward, the 2 motions I've been working on are like literally like kicking this foot out like this, boom, and sweeping this out. And then when you step this leg back, pulling you forward and then blocking that foot right there to like make you fall. So
oh, that's cool.
It'd be cool to like kind of keep going with this and and like use these exercises to strengthen as I'm going for these takedown, because that's like a huge takedown. It's like I'm trying to refine my technique, but that's something I've been dealing with. So this will be good.
Yeah, and that's interesting too, because that same movement that you're doing as you're like pulling me and you're catching it is that same posterior tibialis muscle.
Exactly.
You know?
Yeah.
So like you can really create like a strong block through that foot, and not have to rely on just brute force.
Right. Exactly.
And not like jam up the navicular bone on
Exactly.
the inside.
Yeah. Awesome.
Sweet. All right.
Awesome.
All right,
Thank you.
Yeah, of course.
All right, so today we covered a couple different perspectives on how to not only like heal your foot, but to strengthen your foot. Me and Dr. John are always hanging out and talking, and I'm always like getting attacked by different people. Thor,
Especially me.
Yeah, thanks for Thor always hurting my foot. But no, like there's always different ways of like rehabbing, and there's different ways of strengthening. So what did we go over today?
Yeah, so we went over when someone has attacked your foot, your ankle, and it's popped, what you can do to rehab and recover faster.
And sometimes it doesn't even pop, right? Like sometimes just the strain of somebody grabbing it and you trying to escape kind of like just hurts your foot, or hurts like, maybe we'll move forward talking about the knee sometime soon, but the foot just as a whole is definitely super fragile, right? So learning how to like protect it and then also do the right recovery methods.
Yeah, and with the knee, you've got like, you can bend it and you can straighten it, you can flex it, you can extend it, but your foot and ankle, there's just so much more going on. So
how many bones are there in the foot?
That's a good question.
Chloe!
Hey Google. But
there's a lot of bones. I'm not a doctor, but I'm pretty sure there's a lot of bones.
It's something I had to know at some point. Well, the thing is the range of motion of your foot and your ankle is like much more significant. It'd be like the difference of like your elbow and your shoulder, you know? So like there's just more that you can consider with the foot and the ankle.
But as like for leg locks as a whole, like it's just like, if like it's interesting when you start training with somebody and like you just grab like we're like the 10 Planet Association, so like you were doing leg locks on the first day, but like there's some black belts in the whole world that have like never even done leg locks, and you can tell, like you grab a hold of their foot and they're just like you know, there's just like levels to it. And I think like adding these exercises in, even for me being an instructor, you know, teaching a class and people being like just grabbing their foot, I feel like it's so weak, you know. I'd be like, hey, do these exercises, your foot will get better, or just get stronger overall, you know, and then hopefully not get hurt. But if it does, we have these different ways.
It's good for rehab, it's good for prehab, it's good for strengthening your defense when someone's grabbing your ankle. And these 3 exercises, like I really tried to be mindful and put some time into thinking about simple ways that everyone can like, you know, be better with their foot and their ankle.
And you don't need like a $1,500 machine. Shout out to Hyperice, just one of these little vibrating spheres, or like really a lacrosse ball, a little band, and then the dome exercise is just your foot by itself. So really easy, right? You don't have to buy a lot of equipment.
Do this at least like once a day. If it's feeling really good and you're just starting in your rehab, maybe you actually really did get injured with your foot or your ankle. This would be like multiple times a day kind of situation, especially in those first 2 to 3 weeks that you're regaining comfort in your foot and your ankle. We hope that you like this. We hope that you keep watching us. Don't submit yourself.
Yep, part 2.